So what to do when the cause and cure is you? I get so weak in the knees, I can hardly speak. I lose all control and something takes over.
Assalamualaikum. Today I'm gonna present about introduction radioactivity in the cancer treatment, application, Fourier transform, infrared spectroscopy. Fourier spectroscopy is a method used to analyze a signal by breaking down into their individual frequency. This technique, named after J.B.J. Fourier, is commonly used in a different type of spectroscopy like a Fourier transform infrared spectroscopy. FTIR spectroscopy measures how light interacts with a sample. By using Fourier transform, it can quickly analyze many frequencies at once, making it faster than traditional method. In regular spectrometer, a sample is exposed to light with a different energy, and the absorption peak help identify the sample. But in Fourier transform spectroscopy, the sample is exposed to a pulse containing many frequencies at once, and the resulting signal show with the frequency are most absorbed. This signal is then transformed into the spectrum much faster than older method. FTIR spectrometer use a different type of the interferometer like Michelson and Fabry-Perot to analyze a signal. Michelson interferometer are most commonly used because they are simpler and more accurate. However, FTIR spectrometer produce an interferogram, not a direct spectrum, so a computer need to process the data to create the final spectrum. With modern computer technology, this process has become faster and more efficient, making FTIR spectroscopy a practical tool for many applications.
The next part is theory in physics of radioactivity in cancer treatment. What is radiotherapy? Radiotherapy uses ionizing radiation to damage the DNA of cancer cells, preventing them from growing and dividing. This radiation can also create free radicals that harm DNA molecules, causing cell death or forcing the cancer cells into a non-replicating state. First, radiotherapy is a cancer treatment that uses ionizing radiation to damage or kill cancer cells. Second, the radiation works by damaging the DNA inside cancer cells, which can either kill the cells or stop them from replicating. Third, cancer cells divide much faster than normal cells, which make them more sensitive to radiation. Fourth, some cancer cells may be develop resistant to radiation over time, making them harder to treat. The radiation dose is measured in grays and is given in smaller, divide dose to reduce harm to healthy tissue while targeting the tumor. External radiation. Radiation beams are directed at the tumor from outside the body. Brachytherapy, radioactive sources are placed directly inside or near the tumor. Systemic therapy. Radioactive substances are used to treat cancer by delivering radiation directly to the tumor inside the body. These therapies use the weakness of cancer cells to improve treatment outcomes. The success of radiotherapy depends on factors like the type of cancer and how well the tumor can repair its DNA.
So I want to talk about Fourier transform infrared FTIR spectroscopy of radioactivity in cancer treatment. So number one is FTIR spectroscopy is a powerful tool used to analyze the chemical composition of materials. Number two, not a treatment. FTIR doesn't directly treat cancer, but it's essential in developing cancer therapies and diagnostic. Number three, drug development. It can help determine the molecular structure of drugs, studies how drugs interact with DNA, protein, and lipids to understand their effect. Ensure compatibility of drug with advanced drug delivery systems like nanoparticles or liposomes. Number four, cancer research. It detects molecular fingerprints of cancer cells by analyzing bonds in DNA, RNA, protein, and lipids. It also can help design target therapies by understanding how drugs interact with cancer cells. Number 5. Radiation therapy monitoring. Monitors biochemical change during radiation therapy to assess its effectiveness. Number 6. Quality control. Used in manufacturing to quickly check the purity and composition of drugs and materials. Ensure the quality of radiopharmaceuticals, which is a radioactivity drug used in treatment. Number 7. Nanomedicine. It can help characterize drug delivery systems and ensure they work effectively in training or treating cancer. Number 8 is the last one, personalized medicine. It can help discover biomarkers for early diagnosis and create personalized cancer treatment.
Next is principle of FTIR spectroscopy. FTIR spectroscopy works by studying how infrared light interact with the chemical bonds in a sample. Molecules absorb IR radiation at specific frequency based on how their atoms vibrate. The amount of light absorbed at each frequency creates a FTIR spectrum, which shows the chemical composition of the sample. In cancer diagnosis, cancer cells often have changes in their chemical makeup compared to normal cells, such as difference in protein, lipids, and DNA. FTIR can detect these changes in tissue, helping to identify cancer. It can also distinguish between healthy and cancerous tissue by recognizing how FTIR spectroscopy works. FTIR is a technique used to identify materials by examining how they absorb infrared light. When a molecule absorbs in light, its atoms vibrate and move to a higher energy level. The amount of energy absorbed depends on the difference between the molecule's normal state and the excited state. The specific wavelength of light absorbed can reveal information about the type of bond structure in the molecule. This helps match the molecule's component and structure. Cancer is a major health issue worldwide, with increasing rate due to factors like aging population, diet, and smoking. However, many existing cancer biomarkers are not suitable for widespreading screening and use for who have symptoms.
The last one is conclusion. Fourier transform infrared FTIR spectroscopy is a powerful tool used to study how radiation affects cancer treatment. It is a sensitive, non-destructive method that help identify change in molecules like proteins, lipids, and DNA in both healthy and cancer cells exposed to radiation. This technique allows doctors to see how cells respond to radiation in real time, helping to adjust and personalize cancer treatments for better results. Combining FTIR with other tests and advanced technology can lead to more accurate treatments and help develop new strategies to improve patients' outcomes and reduce side effects.